Fox 5 getting answers tonight about a drug originally designed to treat diabetes, now taking Hollywood and social media by storm as a weight loss wonder drug. You may have heard of it. It's called Ozempic. The prescription medication, which patients self-inject once a week, is sometimes referred to as the skinny pen by its users. Fox 5's Regina Ahn is outside of a clinic in Henderson with what you should know about Ozempic and its potential impacts on your body.
This clinic here in Henderson offers the Ozempic shot, and while it is available, there are some things that you should know before getting the shot.
I took Ozempic for about a month. It worked very well. I lost almost 10 pounds in about 3 weeks. A lot of the popular ones.
Chrissy O'Connell is the owner and one of the nurse practitioners at Health Express in Henderson. Her story is what has been the talk of the town, losing weight with Ozempic.
Health Express Medical Center, my name.
The clinic in its second year is a walk-in clinic as well as a primary care facility. 3 weeks ago, O'Connell introduced Ozempic to her patients.
Person to person and your BMI, how much you weigh. There's other factors if you have comorbidities.
So Ozempic is an anti-diabetic drug. However, it's also a drug that's used for weight management and long-term weight management. It's also known as semaglutide or Wegovy, but Ozempic is for both of those.
Christina Kolvag is a provider at Health Express. She says she's seen about 50 people who have asked for Ozempic specifically.
It helps the body increase caloric burning and also helps the body burn stored fat.
Ozempic originally was an injectable medication used to help control blood sugar for those with type 2 diabetes. Now, with the help of social media, it's become quite the popular drug for weight loss. The drug is not FDA approved. However, the exact same drug under a different name, Wegovy, is. Leanna Oswald is a pharmacist and associate dean professor of pharmacy at Roseman University. She says people should know this isn't a magic potion.
They need to have failed diet and exercise alone before going on to the medication.
However, Oswald says for some people it can be a great resource. It could help with prevention of cardiovascular disease for those who cannot lose weight with diet and exercise. But following trends on social media is not the best thing to do for your health.
There is a space for any weight loss drugs to be added on for patients who have been struggling, who are overweight or obese, especially those with comorbid conditions like heart disease, diabetes, where these medications can be highly beneficial. A cool TikTok craze can end a lot of people in the hospital and can get them sick.
In extreme cases, Oswald says thyroid cancer has been detected during animal studies, and she urges those who are pregnant or could be pregnant, prone to gallstones, to talk with a doctor further. And this trend is also leading to a global supply shortage of Ozempic, and doctors recommend before you jump to get it, you should try your hand at diet and exercise first. A meeting with a nutritionist or a dietitian is covered by insurance. Ozempic for weight loss is not. In Henderson tonight, Regina Ahn, Fox 5 News, local Las Vegas.